Assalamualaikum. My name is Sa'adatul Shalihah binti Ismail. My matrix number is 709431. So I'll be sharing a bit about the introduction of the class of drugs. So vancomycin is an antibiotic that belongs to a group known as glycopeptide antibiotics. It is primarily used to treat serious infection caused by gram-positive bacteria, particularly when the other antibiotics are ineffective or contraindicated. Glycopeptide antibiotics is an antibiotic that works by inhibiting the synthesis of bacterial cell wall. The most well-known glycopeptide antibiotic is vancomycin. Other samples include teicoplanin and dalbavancin. Glycopeptide antibiotics are crucial in treating serious bacterial infection, especially those who are resistant to the other antibiotics.
Assalamualaikum. My name is Danisha Alia binti Muhammad Azrafiz. My matrix number is 079535, and I'm going to explain regarding pharmacokinetics of vancomycin. There are 4 steps in pharmacokinetics of vancomycin. Firstly is the absorption of vancomycin. First is the oral administration. Vancomycin has very poor oral bioavailability due to its large molecular size and hydrophilic nature. Oral administration is specifically used for localized infections in the gastrointestinal tract, such as Clostridium difficult infection. In this case, its poor absorption is beneficial because it remains concentrated in the GI lumen. Second is the intravenous administration. For systemic infections, vancomycin is administered IV to bypass the gastrointestinal tract and achieve therapeutic plasma concentrations, where the peak plasma levels are achieved 1 to 2 hours after infusion. Next is the distribution of vancomycin. After IV administration, vancomycin distributes into extracellular fluids. The volume of distribution is approximately 0.4 to 1.0 liter per kilogram, which reflects distribution primarily in extracellular spaces, including inflamed tissues. First, tissue penetration. In cerebrospinal fluid, penetration is limited under normal conditions but improves during meningitis due to inflammation of the meninges. Next is the lung tissue. Variable penetration with moderate success in treating pneumonia caused by gram-positive organism. Next, in bone, penetration into bone is moderate, making it suitable for infections like osteomyelitis. In skin and soft tissues, effective for cellulitis and other soft tissue infections. Second is protein binding. Vancomycin is 30 to 55% bound to plasma proteins, which affects its free drug concentration. Next is the metabolism of vancomycin. Firstly is the minimal hepatic metabolism. Vancomycin undergoes negligible metabolism in the liver. Most of the drug remains unchanged in circulation. This makes vancomycin less prone to drug-drug interactions involving hepatic enzyme system. Second is the intestinal metabolism. In patients receiving oral vancomycin, the drug remains largely confined to the gastrointestinal tract and is not absorbed into the systemic circulation. No significant metabolism occurs in the intestines, and the drug is excreted unchanged in the feces. Lastly is the excretion of vancomycin. First, by renal elimination. Vancomycin is primarily eliminated via the kidneys in its unchanged form. It is excreted through glomerular filtration, and its clearance is directly proportional to renal function. Second is the half-life of vancomycin. It takes around 4 to 6 hours in individuals with normal renal function and prolonged in patients with renal failure, necessitating dose adjustment or extended dosing intervals. Thirdly is the non-renal elimination, very minimal contribution from other excretion pathways, such as biliary or hepatic. Fourth is the hemodialysis. The extent of vancomycin removal during dialysis depends on the type of membrane used. High flux dialysis membranes remove more vancomycin compared to low flux membranes.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nia Sofia binti Mazai. So now I will present about pharmacodynamic of vancomycin. So what is pharmacodynamic? Pharmacodynamic is what the drug does to our body. So what vancomycin does to our body? First, mechanism of action. Where vancomycin is a glycopeptide antibody which inhibit bacterial cell wall synthesis by binding to peptidoglycan precursor. So, what does vancomycin does to our body? First, mechanism of action, which vancomycin is a glycopeptide antibody which inhibit bacterial cell wall synthesis by binding to peptidoglycan precursors. Specifically effective against gram-positive bacteria such as Staphylococcus aureus and Clostridium difficile. The second one is therapeutic effect, which effective for treating severe bacterial infections such as endocarditis, pneumonia, and osteomyelitis caused by gram-positive bacteria. It's primarily used for methicillin-resistant Staphylococcus aureus (MRSA) infection. The third one is adverse effect, which may cause a nephrotoxicity, kidney damage, and ototoxicity, hearing loss. It also can cause Redman syndrome, which is a histamine-mediated reaction caused by rapid infusion. Key targets. Vancomycin targets and bind to the D-ala-D-ala terminus of cell wall precursor, preventing bacterial cell wall cross-linking and leading to cell death.
Glycopeptide antibiotics are crucial in treating serious bacterial infection, especially those who are resistant to the other antibiotics. It works by inhibiting the bacterial cell wall synthesis, making it effective against gram-positive bacteria, including methicillin-resistant, Staphylococcus aureus, and other resistant organisms. It is commonly used for serious infections like bacteremia, endocarditis, point and joint infections, meningitis, and other serious infections.
Let's go through the dosage guidelines step by step. The first one is intravenous IV dosage. We will start with IV administration, which is the most common route for systemic infections. For adult general infection, the standard dose is 15 to 20 mg per kilogram every 8 to 12 hours. The maximum single dose is usually not more than 2 grams. The dose must be adjusted based on the renal function and therapeutic drug monitoring, aiming for true levels of 10 to 20 microgram per milliliter. On serious infections, a loading dose of 25 until 30 mg per kilogram may be given first, followed by 15 to 20 mg per kilogram every 8 to 12 hours. The target true level should be 15 to 20 microgram per milliliter for severe infections. For children, the dosage range from 10 to 20 mg per kilogram every 6 to 12 hours depending on the infection type and renal functions. On neonates, the initial dose is 10 to 15 mg per kilogram with maintenance doses adjusted based on the postmenstrual age and renal function, which typically be given every 8 to 24 hours. For oral dosage, unlike IV vancomycin, oral dosage is not systemically absorbed. It is used primarily for Clostridium difficile associated diarrhea. For adult, the dosage range from 125 to 500 mg orally every 6 hours for 10 to 14 days. On children, the recommended dose is 10 mg per kilogram orally every 6 hours with a maximum of 500 mg per dose. For dosage adjustment, vancomycin dosage must be carefully adjusted in patients with renal impairment or those undergoing hemodialysis. For renal impairment, the dosage and frequency are adjusted based on creatinine clearance. In severe renal impairment, vancomycin may be administered less frequently, such as every 24 to 48 hours. On hemodialysis patients, since vancomycin is partially removed during dialysis, a supplemental dose is often given after dialysis session. Last one is therapeutic drug monitoring. Monitoring vancomycin level is essential to ensure effectiveness while preventing toxicity. For target true levels, mild to moderate infection, the dosage is 10 to 15 microgram per milliliter. On severe infection, such as endocarditis, the dosage is 15 to 20 microgram per milliliter. On frequency of monitoring, for stable patients,
we should monitor every 2 to 3 days. While on critically ill or renally impairment patients, we need to more frequently monitor them.
Next, we move to the therapeutic effects of vancomycin. Firstly is the effective against resistant gram-positive infections, where the vancomycin is often the drug of choice for infections caused by methicillin-resistant Staphylococcus aureus (MRSA), where it treats life-threatening infections caused by MRSA, such as bloodstream infections, pneumonia, and endocarditis. Next is the Clostridioides difficile. Oral vancomycin is highly effective in treating Clostridioides difficile colitis by targeting the bacteria in the gastrointestinal tract. Next is the other resistant gram-positive organisms, include certain Enterococcus and Streptococcus species, particularly in patients who cannot tolerate beta-lactam antibiotics. Next is the broad clinical applications. Vancomycin's therapeutic effect extends across a wide range of infections, where firstly is bloodstream infections, eradicates bacteria from the blood caused by MRSA or other resistant pathogens. Next is the endocarditis, treats infections of the heart valve caused by gram-positive bacteria. Next is the bone and joint infections, effective against deep-seated infections caused by resistant staphylococcal or streptococcal species. Next, in skin and soft tissue infections, treats cellulitis, abscesses, and necrotizing fasciitis due to gram-positive bacteria. Lastly, in pneumonia, treats hospital-acquired pneumonia and ventilator-associated pneumonia when MRSA is suspected. Lastly is the bactericidal effect. Vancomycin kills bacteria by inhibiting bacterial cell wall synthesis. This prevents bacteria from forming strong cell walls, leading to cell death. It is especially effective against actively dividing bacteria.
Next, what are the side effects of vancomycin? So the common side effect is nausea, vomiting, and abdominal pain. While serious side effect is nephrotoxicity, which kidney damage, especially with prolonged use or high dose. Next, ototoxicity, hearing loss or tinnitus, particularly at high concentration. And the last one for serious side effect is Redman syndrome, where a histamine-mediated reaction causes flushing, redness, itching, and sometimes low blood pressure. This occurs with rapid infusion. And other possible side effect is hypotension, allergic reaction, and neutropenia.
Assalamualaikum. My name is Jasmine Suraya binti Manso and my metric number is 079534. Today I would like to talk about adverse effects. Adverse effects are unintended and harmful reactions caused by a drug, which can range from mild to severe. There are 6 adverse effects caused by vancomycin. The first one is nephrotoxicity, which means kidney damage. Vancomycin can cause damage to the kidney, particularly at high doses or in patients with pre-existing kidney condition. The sign and symptom for nephrotoxicity is decreased urine output, edema in the lower limbs, elevated blood urine nitrogen, and creatinine levels. The second one is ototoxicity or hearing damage. Vancomycin may damage the auditory nerve, especially in prolonged use or high concentrations. Sign and symptom for ototoxicity is ringing in the ears or called tinnitus, hearing loss which may be permanent, and lastly dizziness or balance issues. Next, the third one is Redman syndrome or called infusion-related reaction. It is a reaction caused by rapid infusion of vancomycin leading to histamine level. The sign and symptom for Redman syndrome is include flushing or redness of the upper body and face, itchiness and hypotension, which means low blood pressure. Furthermore, the fourth adverse effect is hypersensitivity reaction. It is immune-mediated allergic reaction to vancomycin. The sign and symptom for hypersensitivity reaction is rash or hives, fever, and lastly, rare but severe condition like anaphylaxis, which means difficulty of breathing, throat swelling, and hypotension. The fifth adverse effect is hematology effects. In rare cases, vancomycin could affect blood cell production. For example, neutropenia, which means low white blood cell count, and thrombocytopenia, which means low platelet count. The sign and symptom for hematology effect is increased infections and bleeding or bruising easily. Lastly, superinfection such as Clostridioides difficile. Long-term use of vancomycin can disrupt normal gut flora, leading to overgrowth of Clostridioides difficile. Sign and symptom for this super infection is severe diarrhea, abdominal pain, and fever.
Next, I'll be presenting a bit about the contraindications. There are two types of contraindication. First one is the absolute contraindications or hypersensitivity. Hypersensitivity is an allergy or hypersensitivity to a vancomycin or any other components, and the manifestation may include rash, anaphylaxis, and other allergic reactions. The other contraindications is the related contraindication, which include urine impairment, renal impairment, pregnant syndrome, pregnancy, and elder patient. The first one is renal impairment, in which the patient with renal dysfunction needs a dose adjustment while using the vancomycin. The second one is the urine impairment, because vancomycin have the risk of ototoxicity. The next one is the Redman syndrome, in which the vancomycin may lead to histamine-mediated reaction, including the rash and hypertension. Next one, the patient who are pregnant or elderly patient, because they have increased susceptibility to nephrosis or ototoxicity.
I will be discussing the nursing care consideration for administering vancomycin. The first one is pre-administration assessment. Before administering vancomycin, a true assessment is crucial. First, we obtain baseline data, including checking for allergies to vancomycin or other glycopeptides. We evaluate the patient's kidney function by reviewing blood urea nitrogen and creatinine levels, as vancomycin can be nephrotoxic. And then we assess hearing function, since vancomycin carries a risk of ototoxicity. Review the patient's medication history to identify potential drug interactions, which particularly with aminoglycosides or loop diuretics, which may increase toxicity risk. Finally, we confirm the indication for vancomycin therapy and ensure culture and sensitivity testing that has been done to guide appropriate antibiotic use. Now let's move on to the actual administration of vancomycin. The most common route of administration is intravenous (IV) for systemic infections, while oral vancomycin is used specifically for C. difficile infections. Vancomycin must be diluted properly, typically in 100 to 250 ml of normal saline, and infused slowly over at least 60 minutes to prevent Redman syndrome, which is a histamine reaction causing flushing and hypotension. A calibrated infusion pump should always be used to ensure accurate and controlled administration. Lastly, the dosage must be adjusted based on the patient's weight, age, renal function, and the severity of the infection. Next is monitoring during administration. While administering vancomycin, continuous monitoring is essential. We monitor vital signs to detect any sign of Redman syndrome, such as hypotension, flushing, or tachycardia. We inspect the IV site for signs of phlebitis or extravasations, which can cause tissue damage. And then watch for hypersensitivity reaction, such as rash, itching, or difficulty breathing, which may indicate an allergic reaction requiring immediate intervention. Next is ongoing monitoring. Even after the initial administration, ongoing monitoring is necessary to ensure patient safety. We monitor the therapeutic drug levels, specifically true levels, which should typically be between 10 to 20 microgram per milliliter to balance effectiveness and prevent toxicity. And then assess the renal function regularly, as vancomycin is eliminated by the kidneys and may cause nephrotoxicity. And then we evaluate the hearing function periodically to detect early signs of ototoxicity, such as tinnitus and hearing loss. Finally, we monitor the patient's clinical response, looking for improvement in symptoms like fever reduction and better laboratory markers. Next is patient education. Patient education is another crucial aspect of nursing care. We inform the patient about the purpose of vancomycin and potential side effects they should watch for. And then we will advise them to report symptoms such as ringing in the ears, hearing difficulty, or reduce urine output immediately. And this can reinforce the importance of completing the full course of antibiotic to prevent antibiotic resistance. The last one is documentation. Lastly, proper documentation ensures continuity of care. The nurses should record the dosage, time, and route of administration. And then document any adverse reaction and patient response to the medication. Take note on any laboratory result, including renal function and vancomycin true levels, along with any necessary dose adjustment.
Next, I would like to talk about health teaching for the patient. In general, the side effects and diet. In general, patients should take medication as prescribed, ensure the medication is taken exactly as directed, whether orally or via intravenous. Do not skip doses. Complete the full course of the medication. Next is hydration. Patients should drink plenty of water to support kidney function, as vancomycin may affect the kidneys. Next is missed dose. If a dose is missed, take it as soon as remembered. If it's near the time of the next dose, skip the missed one. Never double the dose. Lastly is report any allergies. Inform healthcare provider if there any history of drug allergies, especially antibiotics. There are two types of side effects of vancomycin: mild side effects and serious side effects, which needs to report immediately. For mild side effects is nausea, vomiting, diarrhea, or stomach upset. While for serious side effects is Redman syndrome, kidney problem, hearing issues, allergic reactions, and super infection. For dietary, firstly is normal diet. No special dietary restrictions are required unless advised by a doctor. Secondly is probiotic foods. Include yogurt or fermented foods for support gut health, as antibiotics may disrupt gut flora. Thirdly, monitor sodium intake. If on intravenous vancomycin, check for added sodium in the infusion and adjust dietary sodium as needed. The fourth one is avoid alcohol. Limit or avoid alcohol as it can strain the liver and kidneys. And lastly, adequate protein. Include protein-rich foods to support overall healing and recovery. That's all from me. Thank you.